Welcome to Therapy Thursdays on Louisiana Living. We are Physical Therapy and Balance Centers. I'm Angela Yarborough, and this is Dr. Jerry Yarborough.
Hey.
You went through an ordeal 14 years ago and had to learn how to walk and balance again. And you had to figure it out all on your own because there was nothing out there. Right. And we have come so far over 14 years.
Yes, ma'am, we have. And that's the reason we specialize in balance and vestibular rehab at our 6 physical locations here in North Louisiana and South Arkansas. Upon coming to a physical therapist, at least ours, we're going to put you through a lot of tests, a lot of assessments to determine exactly what your impairment is that will put you at risk of having a fall, whether it's dizziness, whether it's an imbalance, a weakness, is it postural, is it vestibular, is it somatosensory? It's not just a blanket diagnosis of, oh, you have a balance issue. There's a lot of different things that could cause that, and your therapist should be very well trained, as we are, to determine that. So because we specialize in that in our physical locations, we have some special innovative equipment that we use. Well, initially I have to say that, Brian Werner is our National Balance Director for Physical franchise, and he has created a paradigm that we treat all of our patients through. You start at this condition, we're going to walk you through until you're back to normal or as normal as possible. Some of the other things that we have here at Physical, we have an overhead tracking system where if you have the fear of falling, that fear itself can make you more at risk of having a fall. So we can put a harness on you, and that'll connect to a rope that is connected to a track up above that'll hold near 1,000 pounds. So it held me. I went down it, made sure it was good and safe. So we can put our patients on that have a fear of falling to work on normal movements, removing that fear, okay? And then another piece of innovative equipment that we have is our Virtuis system. Our Virtuis system uses virtual reality in treating our patients with all kinds of balance issues, okay? So you put on the virtual reality goggles, you're transformed to a whole new environment. You can look all around and you're in a new environment. So in therapy, we're always trying to make things as functional as possible, but with the use of virtual reality, we can make it very functional. You can go, to the grocery store, you can go shoot bow and arrows, you can go out on the ocean, you can, go up and down elevators and to work on fear of heights and things. There, you can go skiing. And with our system, our virtual reality, motion virtual reality system, which we were the first in the country and the only one in this whole region that has this, it really brings everything to life because you're not only seeing it, you're standing on a platform that moves in a way that makes you feel that you're in that natural environment. So again, those are just some of the equipment and some of the specializations that we have to help you overcome your imbalance issues. Okay, so I always want to try to leave you with a few things that you can start doing at home, okay, to help with your balance. If you cannot stand up and sit down, you're at risk of having a fall. So you need to work on that in a safe environment. You should be able to do that 10 times, okay? Another thing is you should be able to stand on one leg for at least 30 seconds. Make sure you're in a safe environment when you try this, or have somebody by you, okay? Another problem a lot of people have is just weakness in the hip. So standing, working, like marching in place. That's another good exercise. So those are some things that you can start doing immediately at home. If you continue to have problems, you need to give us a call. Just a reminder, in Louisiana, we have Jonesboro, Ruston, West Monroe, and Bastrop. And in South Arkansas, we have Dorado. And soon, we'll be all over Arkansas. So guys, give us a call. Don't be a statistic, and let us help you love your life.